Okay, thank you. You'll have 20 minutes total, so we'll try to keep you updated on that, split it up however you want.
Thank you. Good afternoon,
you
chairs and members. My name is Jim Knox. I'm the Vice President of the American Cancer Society Cancer Action Network. And we're here today to talk about an initiative that will save lives, prevent kids from getting hooked on tobacco, improve access to health care, and fight cancer and other tobacco-related diseases. Smoking is the #1 preventable cause of death in our state. Tobacco kills more people than car accidents, murder, suicides, alcohol, illegal drugs, and AIDS combined. The legislature and the governor made enormous and historic strides this year by enacting new tobacco regulations and raising the age to buy tobacco to 21. The FDA has also imposed new regulations on e-cigarettes. We must build on this momentum because we need to use every tool in our disposal to keep kids safe. The California Healthcare Research and Prevention Tobacco Tax Act of 2016 will increase, as you've heard, to California's cigarette tax by $2 a pack, with an equivalent increase on products containing nicotine derived from tobacco. That includes e-cigarettes. It will prevent kids from getting hooked on tobacco, improve health care, and fight cancer and other tobacco-related diseases. That's why the American Cancer Society Cancer Action Network, the American Lung Association, and the American Heart Association all strongly support this measure. We know that taxing tobacco saves lives by helping smokers quit, and more significantly, by preventing young people from ever starting. Nearly 17,000 California kids get hooked on smoking every year, and half of them will eventually die from tobacco-related diseases. Studies show that 90% of smokers start as teens. This initiative can help prevent a new generation of kids from taking up a deadly addictive habit. Unfortunately, the tobacco industry is taking a page from its old playbooks and targeting kids for a lifetime of addiction with candy-flavored electronic cigarettes containing nicotine. Teen use of e-cigarettes grew tenfold in the past 4 years, as Dr. Pan noted. And as studies are consistently showing, teens who use cigarettes are much more likely to go on to smoke traditional cigarettes. Higher tobacco taxes have consistently proven to be the single most effective way to deter youth from starting a lifetime of tobacco addiction. Yet California's tobacco tax is among the lowest in the nation, 35th among 50 states. 48 other states have raised their tobacco tax a total of 130 times since California last raised its tobacco tax 18 years ago. California is a global leader. It's time for us to again take the lead on this issue and protect youth from the predatory marketing and the prospects of addiction offered by tobacco and e-cigarette industries. And the economic burden of tobacco is substantial in our state. It includes the costs of premature death, lost productivity at work, and high rates of hospitalization and use of medical care. Because of tobacco, California taxpayers spend $3.5 billion a year on treating cancer and other tobacco-related diseases through Medi-Cal. The majority of these funds generated by this tobacco tax will be used to improve existing health care systems, prevent tobacco use, and fund research into cancer and other tobacco-related diseases. Under this initiative, the only people who pay are people who continue to use tobacco. If you don't use tobacco, you don't pay. Today, you're going to hear claims about how e-cigarettes are safer alternatives and how they can help people quit smoking. The truth is that there's no evidence that e-cigarettes are an effective smoking device. And there is mounting evidence that e-cigarettes are in fact driving kids to smoking. The simple fact is that e-cigarettes are simply trading one form of nicotine delivery for another. And no matter how you package it, tobacco kills. And taxing tobacco saves lives. And that's why this initiative is so important to our communities, to our economy, and to our healthcare system. Thank you.
Thank you for the opportunity to talk with all of you today. My name is Michael Ong, and I'm a practicing general internist and an associate professor of medicine at the David Geffen School of Medicine at UCLA. I am also chair of the State of California's Tobacco Education and Research Oversight Committee, although I am not here on behalf of the committee. Thanks to your efforts here in the legislature, California has enacted 5 important laws that will reduce the impact of tobacco, the leading preventable cause of death, on the health of California. And we applaud the new laws that you and your colleagues approved to better regulate electronic cigarettes and discourage teens from purchasing tobacco products. However, even with these new laws, we continue to face severe threats to California's health from tobacco after years of progress against the tobacco companies' aggressive, predatory marketing of dangerous products. Tobacco companies have reinvented their prior marketing strategies for e-cigarettes to hook a new generation of consumers. The tobacco industry made Joe Camel nearly as recognizable to children as Mickey Mouse. The Joe Camel of today has evolved to look like these. This looks like Star Wars stormtroopers. This is a Minion. These are things that are recognizable to all children. With the backing of the tobacco industry marketing, it is no surprise that teen e-cigarette use tripled in just 1 year between 2013 and 2014 and continues to climb. The California Healthcare Research and Prevention Tobacco Tax Act of 2016 will increase California's cigarette tax, including on e-cigarettes. With this initiative, California's voters can raise their voices to protect young people from the tobacco industry's predatory and misleading tactics. Now, new data released last week by the Centers for Disease Control and Prevention from its 2015 National Youth Risk Behavioral Survey found that 21% of California's high school students reported using e-cigarettes during the past 30 days, which is even higher than we had seen before. And a study of Southern California high school students just published in the journal Pediatrics last week found that e-cigarette users were over 6 times more likely to initiate traditional cigarettes compared to those never e-cigarette users. E-cigarettes are not just creating a new public health problem, they are creating an epidemic. E-cigarette companies are marketing to teens with flavors like bubblegum and cotton candy. You don't have to believe me, just look at the products. These look like toys and these look like candy. E-cigarettes contain nicotine that is derived from tobacco and is just as addictive as traditional cigarettes. Their aerosol contains formaldehyde and lead, as well as at least 10 toxic chemicals on California's Proposition 65 list of chemicals known to cause cancer and birth defects. And in a time when we are increasingly educated and cautious about what we are exposing our children to, we must remember that exposure to nicotine during adolescence can harm brain development, increase the likelihood of attention deficit disorder, and predispose youth to other addictions. California's Poison Control Centers report that calls for e-cigarette poisoning of kids 5 and under increased by more than 2,000%. And on average, there's enough nicotine in a bottle of e-cigarette liquid to kill 10 children. Neither America's doctors, the U.S. Preventative Services Task Force, nor the Food and Drug Administration consider e-cigarettes a cessation product. In fact, recent studies find users of e-cigarettes are less likely to quit smoking, and teens using e-cigarettes, as I mentioned, are more likely to start smoking. It's important to note that FDA-approved smoking cessation products are exempt from this initiative. So using e-cigarettes and vaping is not harmless. It is not cooler. It has the same addictive nicotine as puffing on traditional cigarettes. Tobacco companies have assured their shareholders that e-cigarettes are the future because they know that effective regulations, taxes, and education are stigmatizing traditional cigarettes. They know that we have effectively unraveled decades of lies and manipulation by the tobacco companies about traditional cigarettes. And there is a reason why the top 4 e-cigarette companies are owned by tobacco companies. Cigarettes and other tobacco products, and now e-cigarettes and other electronic smoking devices, pose a dangerous threat to our future. We must battle this new front with the same fervency that we have other public health emergencies. Our children and grandchildren deserve this. Thank you.
Thank you.
Hello, good afternoon, Dr. Wood and fellow committee members. My name is Carol Magruder, and I'm the co-chair of the African American Tobacco Control Leadership Council. We are a member of the Save Lives Coalition, and we are here to support the California Healthcare Research and Prevention Tobacco Act of 2016. As you know, this act will increase the package of a package of cigarettes by $2, but it will more importantly increase the cheap tobacco products marketed to low-income African American, and Latino communities across this state. The AATCLC is a California-based collective of African American tobacco control advocates with a collective 200 years of experience in public health policy. We are researchers, academicians, activists. We are community members, mothers, fathers, sons, and daughters. Most of us have been personally touched by what statisticians refer to as lost years of life, lost years of productivity. These terms are used to quantify the death and disease attributable to the rampant tobacco use in our communities. I myself lost my beloved Aunt Barbara Lois Oldham a resident of Los Angeles who died at the age of 58 from emphysema about 20 years ago. AATCL member Dr. Valerie Yerger, a researcher with the University of California, San Francisco, lost her mother, Bobbiette Walker, who at age 73 died from pulmonary and respiratory disease due to smoking. Bobby, as she was called, was smoke-free from November 1994 until sometime in 2009 when she relapsed and started smoking again. She, as well as my aunt, were closet smokers at the end of their lives, their addiction compounded with shame. They didn't know that that shame rested squarely with the tobacco industry that perniciously targeted and addicted them to cigarettes when they were teenagers. That shame now rests with us if we fail to enact legislation and public policies that protect our young people from a lifetime of addiction. It rests with us if we fail to provide cessation services to help people quit and stay quit. Our council has diligently been working to save the 45,000 black lives lost each year in this country from tobacco-related illnesses. We were formed in 2008 and have been at the forefront of the national debate on banning the sale of mentholated and other flavored tobacco products. I have here in my notes the statistics that I will recite, statistics about the enormous costs that all Californians, the vast majority of whom are non-smokers, pay to subsidize, or in the case of poor smokers, pay in full the health and societal cost of smoking. These numbers don't, and in fact can never capture the true human toll. Statisticians can never quantify the loss of a black grandmother. They don't know, they never could know the importance and the role of the black grandmother dead at 60 from lung cancer, her importance and stature to her family increasing in inverse proportion to her often negative net worth. As November approaches, it is this low-income black smoker that the tobacco industry will try to protect through the use of their front groups as they claim that tobacco taxes are unfair and regressive to low-income smokers. They will argue that the price of this deadly addictive product should be kept low and affordable for them. It is true, low-income smokers and young people are price-sensitive, meaning they quit smoking or perhaps never start when cigarette prices are raised high, and we believe that is a good thing. I can assure this committee that no group cares more about low-income and poor smokers than we do. It has been our life work to defend and protect them from the predatory attacks of the tobacco industry. It has been our life work to defend them from the indifference and inequitable application of public health policy. With the historic passage of Prop 99 in 1988, California became the beacon not just for the rest of our country, but the whole world, as we showed them what could be done with good, comprehensive tobacco control policies. We have made tremendous gains, coming in behind Utah with our smoking prevalence now at 12% or less. But that 12% doesn't include African Americans, whose prevalence is 21%. And among low-income African Americans, this rate is 29%, the highest rate of any large ethnic group in this state. That 12% doesn't include American Indians, nor does it include the LGBT community with a smoking prevalence of between 25 and 35%. All boats did not rise with the high tide of California's public health victories. Lung cancer remains the leading cause of cancer death among Hispanic men and the second leading cause among Hispanic women. This Tobacco Prevention Tax Act has been carefully crafted. It has layer after layer of safeguards to protect taxpayers, ensure research money stays in the state, and it does not create any new agencies or government bodies. It strictly limits administrative spending to no more than 5% of the revenue generated, and it also requires biennial audits. But for us, this initiative also explicitly has provisions that address health inequity. Tobacco consumption is one of the main drivers of health inequities. Minimally 15% of the revenue generated for tobacco prevention and cessation will be focused on addressing and eliminating health disparities. This is critical because though priority populations bear the brunt of the insidious and predatory targeting of the tobacco industry, we have no foundations or voluntary organizations whose sole purpose is to defend us from the tobacco industry. Our leadership, advocacy, and capacity building efforts are in most part funded through revenue generated from tobacco taxes. Our communities have suffered as tobacco tax revenues have declined year after year. While the new bill signed by Governor Brown have made enormous and historic strides, we need to continue these efforts by increasing our tobacco tax to restore California's once stellar tobacco control program. And we need to build health equity so that all Californians can equally benefit. Thank you.
Thank you very much. Questions from Dr. Pan? No? Okay. Well, thank you very much for the presentation. Appreciate that. We will now move on to opponents. So as with our proponents, you'll have 20 minutes, and you can split it up whatever works best for you.
Good afternoon, everyone. I'm Joshua Crane, president of the California chapters of the Smoke-Free Alternatives Trade Association. I oversee the Southern California, Northern California, and High Desert chapters of that organization. I'm also the COO of Los Angeles-based Craft Vapory. Today I'm joined by Carrie Hess, who's the co-president of our Northern California chapter of SFATA and owner of NorCal Vape in Redding, California. Founded in 2012, the Smoke-Free Alternatives Trade Association, also known as SFATA, is the largest trade association in the vapor products industry with more than 1,000 members and 27 chapters located across the country. We represent online retailers, brick-and-mortar vendors, distributors, manufacturers, professional service providers, importers, and wholesalers. Our industry was built by former smokers that morphed into small and mid-sized businesses as a way to offer a significant alternative to combustible tobacco. In California alone, we have 150 members of SFATA. There are approximately 1,400 vaping retail locations, plus hundreds of manufacturers, distributors, and related businesses that contribute to the state's economy and generate taxes and thousands of jobs. We believe these jobs are at risk if vapor products are taxed like combustible cigarettes because they will become so expensive that smokers will be less likely to consider them as an alternative. Our goal here today is to make sure that this esteemed body and the California voters are fully aware of the failings of the California Healthcare Research and Prevention Tobacco Act of 2016, the ballot measure that seeks to increase cigarette tax by $2 per pack and put the equivalent increase on taxes of vapor products. While the cigarette component of this bill may be clear, the extension to vapor products and the ramifications on public health, mainly the 3.8 million Californians who still smoke and the nearly 2 million self-identified vapors in the state, is not clear. And as someone who has studied neuroscience, it's hard for me to fathom why vapor products are not being heralded as the single most effective improvement in public health in our modern age. Vapor products already have the potential to continue the most dramatic decrease on adult smoking we have ever seen. E-cigarettes have been demonstrated by Public Health England to represent, at most, 5% of the total risk profile of combustible tobacco. That study concluded that the UK should not only support, but supply electronic cigarettes to current adult smokers in the UK. The Royal College of Physicians, the same group that in 1962 publicized the harm of tobacco for the first time on a global scale, not only confirmed the Public Health England report, they went a step further, endorsing vaping as a harm reduction tool, stating that regulations should not inhibit the development or use of vapor products, and as well concluding that e-cigarettes are not a gateway to combustible tobacco smoking. E-cigarettes are not normalizing smoking behaviors, and if anything, e-cigarettes are proving to be a gateway from smoking. That more e-cig users have more opportunities to quit, they take advantage of those opportunities, and they are more successful with those opportunities. The way this initiative is written is grossly misleading to the voters in California, and it's more of a reflection on our public health war on tobacco without actually considering how these products can reduce the public harm created by smoking. The language lumps vapor products in as an afterthought, without explaining the impact on public health of these products and the tax that it will impose. Broadly speaking, we believe that this tax would be dangerous to public health. To us, the small business owners, and for the millions of smokers who are still smoking in California, and 40 million across the country, as well as the many who have already made the switch to vapor products, these vapor products are not an afterthought. They're actually saving lives. For me, it's not just about the thousands of small businesses in California that will be negatively impacted by this initiative. It's personal. I was a 2-pack-a-day smoker, 2 packs a day. I tried the gum, I tried the patch, I tried hypnosis, I tried acupuncture. The only effective method for me was vapor products. Now we have a product that science has said is 95% less harmful than the combustible tobacco counterpart. Yet we're going to subject it to the same punitive, regressive sin tax that was designed to restrict, impede, and outright punish combustible tobacco. The harm of combustible tobacco is well documented. And the taxes that are levied, we believe, are appropriate for the relative risk of combustible tobacco products. Yet vapor products, with all of their demonstrated reduction in that relative risk, reduction in adult smoking rates, and at least partially responsible for the largest decrease in both adult smoking and teen smoking, are now being subjected to what is essentially an enormous tax. The initiative doesn't mention that the wholesale tax on vapor products could potentially add $8.30 to each $10 wholesale transaction. The cigarette tax proposes a $2 increase. It's 87 cents today. It's going up to $2.87 should it pass. That's a 320% increase in that tax. I'm going to say that again. 320% increase in that tax. The BOE just informed you that they intend to raise the OTP tax rate by an equivalent amount. So taking that 2.73% gets you to 8.3 and change. But we're here trying to demonstrate to you that these products are 95% less harmful than their combustible tobacco counterparts. So why then should they be subject to the same 320% tax increase that combustible tobacco is going to be subjected to? Why is this being hidden from voters? Nowhere in the language is this explained. As a matter of fact, the language provided by the LAO does not accurately represent how or why the taxes should be applied to vapor products. And by omitting these facts, we're basically implying that vapor products carry the same relative risk as combustible tobacco. Could it be that the proponents of this bill think that it would be less likely to pass if voters knew the truth? That vapor products would undergo an astronomical tax increase, a tax increase that would make it far more difficult for smokers to consider them as alternative products? Many believe that this misguided measure is driven more about money than protecting California's public health due to the fact that tobacco tax revenues are declining as adult consumption rates continue to fall. In other words, you're losing tax revenue off of cigarettes as cigarette users move over to vapor products. Is the fear that we're losing revenue, or are we actually trying to save public health here? The sad truth is that California received $1.52 billion in excise taxes and settlements in 2014, but only used 4.3% of that in prevention and cessation programs, meaning 95.7% of tobacco tax revenue did not go to helping Californians quit smoking. Some of the revenues from these proposed taxes will go to pay for existing tobacco-funded programs, many of which are advocated by the initiative authors and not directly linked to actually smoking cessation programs. Voters ultimately will decide if these self-serving programs, including giving the University of California $40 million each year to increase the number of primary care physicians and emergency physicians trained in California, should be funded by taxing e-cigs. Voters should also realize that proposed new taxes will pay for programs aimed at discouraging people from using vapor products. So we're going to tax products that are far less harmful than combustible tobacco, and then use that revenue to keep people off of these less harmful products. My opponents have claimed that protecting minors is their rationale for a punitive sin tax. Let's be clear. Vapor products are intended for adult smokers. They are sold in age-verified and age-regulated environments. The average age of a vapor is 39 years old. 39. And according to studies, 90% of current vapors were former smokers. Nobody wants to see minors, now 21 in this state, using an age-restricted product. But a regressive tax is not the answer. By not clearly explaining how the tax would be applied to vaping products, we're misleading voters, and that's the danger to public health. Consider that the number of people smoking has hit a historic low, reported by the Centers for Disease Control, and it's likely a result of former smokers switching to vaping. The number of smokers are not going up, they're going down. So where's the gateway effect from e-cigarettes to combustible smoking? It's simply not present in the data. And despite the headlines that e-cig use is up amongst teens, look within the data. The National Institutes of Health Monitoring the Future study found that amongst those teens that used e-cigarettes, 78% of them used an e-cigarette product that did not contain nicotine. Assemblymember Pan. 78% of them were not exposed to nicotine. Sorry, I apologize. In other words, whenever have we had a product for the youth of America who are prone to sampling and trying anyway? When have we ever had a product that they could try that was a quote-unquote nicotine product or tobacco product, as it's been labeled by our state and as this committee, When have they ever had a product they can try that did not expose them to nicotine? A recent editorial by the Orange County Register pointed out that in New York, higher taxes have led to skyrocketing cigarette smuggling, and they estimate that they've lost something like $400 million in tobacco revenue per year. As this debate moves forward, I would argue that we not lose sight that vapor products present an opportunity for a transformative reduction in the harm caused by smoking. Even the FDA has acknowledged that vapor products may be a viable option to help smokers who are otherwise unable or unwilling to quit. There were a couple of comments that were mentioned earlier, some by opposition, that I just wanted to address really quickly. I heard several times about predatory marketing and how big tobacco is fueling the e-cigarette industry. I have to urge everyone listening that that's simply not true. Our industry is largely not big tobacco. It was mentioned that the top 4 electronic cigarette manufacturers are owned by big tobacco. I would ask that they identify which 4 those are. To our knowledge, the vapor industry is largely comprised of small businesses who, in total, comprise the largest anti-smoking group in this country. We are as against combustible tobacco as any of our opponents from the American Cancer Society or any other public health group will come forward. We are for increases in taxes on combustible tobacco. We are against blindly lumping them to vapor products when the science and the data are accumulating. And when our opponents said there isn't any data, we would beg to differ. And this is just the sampling of the survey that we brought with you to share. They said that I also want to mention the pediatric study that came up several times saying that youth are 6 times more likely to try smoking after trying electronic cigarettes. We believe that this study is fundamentally flawed, and here's why. They defined smokers, as anyone who had ever tried a puff of a cigarette once. They defined e-cigarette users as anyone who had tried a puff of an e-cigarette once. We would argue that one-time trial does not constitute behavioral for life. We would argue that in order to actually show a normalization of smoking behavior and actually show that e-cigarettes later drove people to cigarette use, that you would not be able to study a population that took 1 puff of an e-cigarette and ask them later if they took 1 puff of a cigarette. You would have to follow that population. You would have to see that they actually became addicted to nicotine, failed to continue to use the electronic cigarette product, and then switch to a combustible tobacco product. So I urge you to do what we've been doing all along. Look beyond the headlines. Look into the data. Understand that what we are offering as the electronic cigarette and vaping industry is a technology-driven alternative to combustible tobacco. We are working to mitigate all, if not most, of the risks and harms associated with combustible tobacco. Earlier, I heard mention of formaldehyde, and several other chemicals that come out of electronic cigarette products. Again, look beyond the headlines and into the actual data. Formaldehyde is not generated by our products unless they are misused. Formaldehyde is only apparent in what's called a dry burn scenario, i.e. there is no liquid in the device. In essence, what you're doing is burning wicking material. You're burning a plant, which is the same thing that happens during combustion. Used properly, with liquid in the device, dry burn scenarios do not occur. Formaldehyde does not occur. So of those 4,000 chemicals that we know are killing people in cigarettes, there are a handful, and only a handful, found in these products. That's why we're not up here saying they are completely safe. We are saying they compromise 5% of the total risk profile of combustible tobacco. So should products that comprise 5% of the total risk profile carry 100% of the tax burden? We would argue that they don't.
Just going to let you know you're at almost 13 and a half minutes.
With that, I'm going to turn it over to my counterpart, Carrie.